Hi, I'm Nikole, a psychiatrist and the Chief Medical Officer at Talkspace, and I'm here at FitOn today to talk about handling obsessive thoughts and unwanted habits. People throw the term OCD around casually, describing themselves or others as OCD when they really mean that somebody is super neat or detail-oriented. But true OCD, which stands for obsessive compulsive disorder, is about a whole lot more than being neat. OCD is a psychological disorder brought on by anxiety, intense stress, or fear, which produces behaviors that are both obsessive and compulsive, which the individual has almost no control over, and which interfere with work or relationships. Even if you don't have an OCD diagnosis, you might experience intrusive or obsessive thoughts or compulsive habits that you wish you didn't, which cause some degree of distress. You might worry or ruminate over things beyond what's rational or productive, or have behaviors that you find yourself doing even though you don't want to. A common type of talk therapy called cognitive behavioral therapy, or CBT for short, can really help. Together with a therapist, you can examine what triggers your unwanted thought patterns and habits. You'll likely discover that certain beliefs cause your urge to obsess or ruminate over certain things, and that these beliefs are either untrue or less important than they might seem. CBT helps you question those unhelpful beliefs and interpretations and replace them with more helpful thought patterns. If you do have patterns more suggestive of obsessive compulsive disorder, you might benefit from a type of therapy called exposure and response prevention. It involves exposure in a controlled way to your triggers to gradually desensitize you to them. The goal is to help your brain learn to tolerate uncertainty and reevaluate perceived threats. Most people find that therapy really helps within 3 months or less. But I get it that you might not have access to therapy right now and could want some more immediate solutions. When you're stuck in a mental loop you're trying to break out of, I recommend you try grounding techniques. These techniques are also recommended for anxiety episodes, which makes sense because obsessive thoughts or compulsions have anxiety at their core. Grounding techniques disrupt your thought patterns by centering you on your physical surroundings. One effective grounding exercise is called 5, 4, 3, 2, 1. Try finding 5 things you can see around you. You might look for 5 beautiful things, 5 ugly things, or 5 things of a certain color. Take a moment to look around you and look for these 5 things. Now let's look for 4 things that you can touch, or make it more complex by looking for 4 different textures. What 4 textures can you feel in the room you're in? Next, look for 3 sounds you can hear. This one takes some concentration. Let's hold for a few moments and listen for 3 sounds. Now, how about 2 things you can smell or imagine smelling? What can you smell in the room from what you had for breakfast? Or even think of your favorite smell. Finally, 1 thing you can taste or imagine tasting. If you can't smell or taste anything, try to remember the sense and flavor of the last food you ate. By the time you've completed this exercise, you're hopefully now feeling centered in your body and not spinning in your head. In addition, there are a few healthy lifestyle habits that can help you prevent experiencing unwanted thought patterns and compulsions in the first place. Number 1 is mindfulness meditation. Daily meditation using mindfulness practices involves quiet observation of your thoughts and feelings while trying to withhold reactions or judgment. You can spend as little as 5 minutes a day on it, although ideally you'll meditate for longer, up to 20 minutes or even a half hour. Meditation and other mindfulness exercises help ground you in the moment and give you a calm perspective on your thoughts and state of mind. Number 2, no surprise, regular exercise can help a lot. It's easy to forget, but moving your body regularly is pretty essential to mental well-being. It not only releases calming, feel-good chemicals into your bloodstream in the moment, It also fosters the growth of new neurons and strengthens neural connections, making your brain more flexible and resilient in the face of anxiety. A third thing you can try is medication, if a medical provider recommends it. These other techniques can be very effective, but for some people, they won't be enough. If your obsessive thoughts or compulsive habits continue to interfere with your life, you should see a psychiatrist or other medical professional trained in psychiatry to see if you'd benefit from prescription medication. Certain common mental health medications can reduce your symptoms dramatically or even resolve them, especially when used in combination with therapy and the other techniques we've discussed. Finally, remember that moving past unwanted thoughts or behaviors isn't a matter of simple willpower, and you aren't weak or lacking in self-control. Your symptoms could be the result of your past experiences or simply the way your brain is wired. But be encouraged by the knowledge that our brains also have a huge capacity for change. So working to overcome unwanted habits or thought patterns can create lasting changes that lead to greater calm and mental well-being.